NCLEX RN Practice Test PDF 2026 questions to study offline easily. Question 1. A patient has partial thickness burns to both legs and portions of his trunk. Which of the following IV fluids are given first? Option A, albumin. Option B, the D5W. Option C, lactate Ringer's solution. Option D, a 0.9% sodium chloride solution with potassium. The correct answer is option C, lactate Ringer's solution. Lactate Ringer's is the preferred isotonic solution for initial burn resuscitation as it most closely resembles the electrolyte composition of plasma. Question 2. Which of the following techniques is correct for obtaining a wound culture specimen from a surgical site? Option A, thoroughly irrigate the wound before collecting the specimen. Option B, use a sterile swab and wipe the crusty area around the outside of the wound. Option C, gently roll a sterile swab from the center of the wound outward to collect drainage. Option D, use a sterile swab to collect drainage from the dressing. The correct answer is option C. Gently roll a sterile swab from the center of the wound outward to collect drainage. Collecting the specimen from the center of the wound using a rolling motion ensures that fresh exudate is captured rather than surface contaminants. Question 3. A nurse is administering 4-furosemide to a patient admitted with congestive heart failure. After the infusion, which of the following symptoms is not expected? Option A, increased urinary output. Option B, decreased edema. Option C, decreased pain. Option D, decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a diuretic intended to reduce fluid volume. It is not an analgesic and is not expected to directly decrease pain. Question 4. There are a number of risk factors associated with coronary artery disease. Which of the following is a modifiable risk factor? Option A, gender. Option B, age. Option C, obesity. Option D, heredity. The correct answer is option C, obesity. Obesity is a lifestyle factor that can be modified through diet and exercise, unlike age, gender, or heredity. Question 5. Tissue plasminogen activator, TPA, is considered for a patient with myocardial infarction. Which of the following is a contraindication for treatment with TPA? Option A, worsening chest pain. Option B, history of cerebral hemorrhage. Option C, history of prior myocardial infarction. Option D, hypertension. The correct answer is option B, history of cerebral hemorrhage. A history of cerebral hemorrhage is a major contraindication for thrombolytics, TPA, due to the extreme risk of a new intracranial bleed. Question 6. Following myocardial infarction, a hospitalized patient is encouraged to practice frequent leg exercises. Which of the following choices reflects the purpose of exercise for this patient? Option A, increases fitness and prevents future heart attacks. Option B, prevents bedsores. Option C, prevents DVT, deep vein thrombosis. Option D, prevent constipations. The correct answer is option C, prevents DVT, deep vein thrombosis. Immobility post-ME increases the risk of venous stasis. Leg exercises promote venous return and prevent DVT. Question 7. A patient with myocardial infarction progresses to cardiogenic shock. Which of the following symptoms should the nurse expect? Option A, hypertension. Option B, bradycardia. Option C, bounding pulse. Option D, a confusion. The correct answer is option D, confusion. Cardiogenic shock leads to decreased cardiac output and poor brain perfusion, resulting in restlessness, anxiety, or confusion. Question 8. A patient with a history of congestive heart failure arrives at the clinic complaining of dyspnea. Which of the following actions is the first the nurse should perform? Option A, ask the patient to lie down on the exam table. Option B, draw blood for chemistry panel and ABG. Option C, send the patient for a chest X-ray. Option D, check blood pressure. The correct answer is option D, check blood pressure. The first step in assessment for a patient in distress is checking vital signs to determine the severity of the hemodynamic status.